Good afternoon, everyone. I'm Margaret Mueller, the President and the CEO of the Executives Club of Chicago. Thanks so much for being with us today. We're going to give everyone a minute or two to settle in because we're right at 12. So while we wait, please enjoy this video from our presenting sponsor, KPMG. Big thank you to KPMG for sponsoring our Chicago CEO series here at the Executives Club and allowing us to have this conversation today with Charlie Mills, the CEO of Medline. I also want to thank our gold sponsor, United Healthcare, and our silver sponsors, OptimaRx and Sidley. For those of you who have not joined us on GoToWebinar before, if you hover your mouse on the right-hand side of your screen, there's a quotation bubble icon, and there you can ask speakers or questions of our speaker. I know that Linda's going to do her best to try to get to as many of those as she can this afternoon. And you can also see a paper icon on the screen, and that opens up today's program. It includes the agenda and then details on upcoming programs at the club. We have a lot of great CEOs and speakers coming to speak this season. So we're ready for this conversation. Before we kick off, I just want to introduce Craig Bartholomew of United Healthcare Illinois. He's going to share some opening remarks and introduce our speaker and our moderator. Over to you, Craig.
Thank you very much, Margaret. Good morning. My name is Craig Bartholomew, Executive Director of United Healthcare Illinois, and I am humbled to welcome you all today. I am pleased to share that United Healthcare is a proud sponsor of the program and the Executives Club of Chicago. I appreciate this opportunity to make the opening remarks for today's event. Medline and United Health Group, both United Healthcare and Optum, have a nearly 20-year partnership, of which I have personally enjoyed working with Medline for the last 11. Charlie and his team are leaders in thought and adoption of ideas, services, and programs which support their employees with benefit coverage to deliver effective quality healthcare. Their efforts are recognized as evident by Medline being named one of Chicago's top workplaces for 10 years, as this award is given based upon feedback from Medline employees. As we pass the one-year mark of COVID hitting our nation and our world, we have never been more aware of the need for PPE and medical equipment. When the pandemic hit, Northfield-headquartered Medline showed up with a swift pivot from quietly supplying nursing homes, hospital systems, and pharmacies for the past 100 years to standing at the forefront of providing protection to millions of healthcare workers and their facilities as the globe battled COVID-19. Today, I look forward to hearing from Medline Chief Executive Officer Charlie Mills. As Margaret mentioned, please encourage everyone to participate in the conversation by submitting questions for Charlie via the Q&A button on your screen. I want to leave plenty of time for this robust conversation, so without further ado, I will pass it over to our moderator, Linda Imonti, Office Managing Principal, Chicago KPMG. Linda?
Thanks, Craig, and good morning, everybody. Charlie, thanks so much for joining us this morning. It's great to have you here with us. What an exciting time for your business and your organization. So I want to start back at the beginning. Let's start out talking a bit about the family business. You are the fourth generation of family to lead Medline. So I think it'd be great for our attendees to hear about some of your earliest memories of working at Medline and how'd you prepare for your roles at Medline that you've had?
Well, first I want to thank you, Linda, for doing this and thank the Executive Club and Margaret, Craig, so much appreciated. I started at Medline very young. I literally started working at age 6 or 7 and would come in after school or on weekends or in summer and assemble admission kits, and I'd be in the warehouse making product, and some poor hospital would get kits made by a 6-year-old. That's it was a small family business back then. And when I was in high school and college, I worked after school, and during summers, I worked mostly in the IT department. I think my father felt we didn't really understand IT at that point, and that would be a way to do it. I'm sure I was probably pretty mediocre. I was writing programs and things like that. And then after college, I worked for IBM for a couple years, and then started at Medline as a sales rep. And frankly, most of our top executives started in sales. It was a very customer-oriented way to learn the business. So that's kind of the start. So
when we were prepping for today's call, you shared a story with me also. I think you remember talking about riding your bike over in the summers to work.
Oh, yeah, I would. My parents were divorced, and I would ride. Before I was 16, I would walk or ride my bike over to my dad's house and be there before, he left, and would go to the office with him. And whenever he got home, which was usually a, longer than average day, I would come home. And, I had various jobs. I think one of those summers I was a computer operator. And on the other hand, my dad, I also remember, had a convertible. The summer I was 15 and I had my learner's permit, but would be driving his convertible to and from work, and playing whatever music we could, and it was fun. So
those are some nice memories.
Yeah.
So you became the CEO in '97, and at that time, the reports show the company was at about 500 million in sales, and it's reported now to be over 17 billion. So can you share with the group a little bit about who Medline is, how you were able to achieve this double-digit growth? And you've had double-digit growth in 53 of the last 54 years, including 24 straight years while you've been the CEO. So I think it would be really interesting to our group to hear, who is Medline, and then what are the key things that allow the organization to achieve at this level?
So we were 17.5 or 17.4 billion in revenue last year. We have about 28,000 employees, and we've been very fortunate. We've had good growth. Early on as CEO, I emphasized service. There were a lot of things that I helped put together that, maybe my dad didn't necessarily purely agree with. And I think our service reputation is better than our competition now, significantly better. I also emphasize calling on many of the big customers. We would, back then there were big purchasing groups, and we wouldn't call on them on any frequent basis, but maybe a 50-bed nursing home would get called on frequently, and it didn't quite make financial sense. We have worked very hard. Many hospitals have prime vendor suppliers, and we really weren't in that business. And many manufacturers don't sell direct to hospitals. They sell through these prime vendor companies, and we've started about 20 years ago doing that, and we've gone from nothing to maybe 40% of the market last year, and we're the biggest seller of market, #1 in market share. So that's been growth. And there are other new markets. We weren't selling physician office until about 10 years ago, and I decided to do that. And we were many hospitals were buying more and more doctor practices, and it seemed somewhat integrated with acute care. And we have gone from nothing to about 750 million in that segment. There's still a lot, of runway left. But I mean, things like that. And we've had a few minor acquisitions, not most of it's organic, but we've had some acquisitions that have helped those numbers too.
So opening up new markets, some inorganic growth as well as your organic growth has really helped you drive those significant numbers in those growth areas. You're also, the organization is also very involved in innovation in the healthcare field, and really with a goal to advance your clients and their capabilities. And we've gotten to know you even more. I mean, you've been more visible even through this last year with the COVID pandemic. But I think it'd be really interesting for us to learn a little bit more about the breadth of your products, how you're involved in innovation, what types of things you might be looking at around innovation. Just kind of help us understand kind of your current and your future vision there.
Well, I think we are a very nimble company and we respond quickly. We do have a lot of patented products, and some of them are very innovative, but many of them are minor benefits and tweaks over other brands. We have worked very hard to integrate both manufacturing and distribution into one package, and that's been somewhat innovative, and we've provide a lot of education along with our products to help our customers, and that's been helpful not just in acute care, but even more so in long-term care, nursing homes, home care markets where maybe the expertise isn't quite at the level that you see out of these big hospital systems. We've worked very hard to have state-of-the-art distribution centers and have technology, robotic picking and things like that. And I think this has been somewhat innovative. And I don't know, we're the leader, and there are certain products that get reprocessed throughout the world, but not in the US. And we've become very strong at reprocessing in the US, and some products that really shouldn't be single use. We've been able to work with hospitals and coming up with programs to clean and re-sterilize and package these products and get better value out of them. I don't know, some of these are just different things that we've done.
Yeah. For Medline, you're privately held today. Has that had an impact on your ability to grow, or you referenced a minute ago that you're very nimble? Has that had an impact on the ability to be agile in the market or innovate or take on some of this new product? Or what impact did that have on your significant growth over the last years?
Well, I think it's been beneficial being privately held. We are making lots of investments that are long-term payoffs that probably hurt us in the first year or two, and whether it's building buildings all over the place or different product lines we've entered or different sales forces, these things don't pay off quickly, and I'm not going to get fired, so I might be willing to make longer term commitments that if we had owners that had more of a short-term horizon, maybe we wouldn't make. And so I think that's been quite helpful. And maybe if we were a public company, we might have been more acquisitive, and maybe that would have helped growth, but not necessarily organically. Most of our earnings we've just put back into the business and help fund all different things, whether it's working capital to a manufacturing site to smaller acquisitions. And so I think being privately held has helped us.
I'm going to switch topics just a little bit here, and looking at, we're a year now into, and a few months into the first COVID cases that appeared in the U.S. And with your worldwide reach, you may have had some, inclination on the pandemic and the pandemic and the U.S. combined, right? And may have had some foresight to what was coming. But what initial steps did Medline take to really gear up for the response to COVID? And I know that there was a significant amount of kind of readying that you did with your team there to be prepared to really support communities as a whole across the U.S.
There's, Linda, there are hundreds of things. In January last year, we were air freighting product. The shortages on personal protective equipment started in other countries very quickly. This thing hit Italy a month or two before it hit the U.S. There were a lot of places that were scrambling for supplies early. So, and it seemed probable that it was going to hit the U.S. because it was just taking off everywhere else. So we normally our inventories are pretty high, and we did what we could to air freight and try to mitigate some of the problems. And we also increased our inventory on non-COVID related products to have our customers have less to worry about, so they could just, focus on what they might need for COVID. We started manufacturing hand sanitizer last spring, and in Wisconsin and Connecticut, we were making isolation gowns. We've always made reusable ones, but we started making disposable. We make face masks in Georgia now. I mean, there are things that we jumped on to try to do what we could, and really thank our employees. They did a wonderful job of handling this, especially our employees that work in manufacturing and distribution locations. I mean, they really had to, work hard, and we did, do things to social distance and provide, masks and things like that. But they really kept us going and kept our customers going.
Yeah, I think one of the articles I was reading, it was talking about you initiated kind of around the clock production in order to meet demand.
Yeah, on certain products. So this was a difficult thing. I mean, we had certain categories that were frankly small categories for us, and they skyrocketed, lab products, masks, etc. And there were other products, surgical related, where procedures got cut. I mean, we have 8,000 employees throughout the world that assemble surgical procedure trays, and our volume in April and May was about half of what it was prior to that. And we did what we could. We didn't lay people off. We figured out, how to balance how high we would let inventory go, and we didn't have overtime and things like that. So it was a lot of reallocation of people. And there were some facilities where we could add product that wasn't normally made or packaged there. And then others, we just did the best we could to balance with, what we had to do. And our distribution centers were very busy. I mean, people, many hospitals, many customers, period, were trying to order heavy just to have safety stock. And, we're trying to balance that extra volume with the amount of people we have. And I think we got through it pretty smoothly. I mean, a million meetings on inventory and how we were going to handle the supply chain and keep it going as smoothly as possible.
So a lot of kind of stress during that time, and I think that a lot of pride, I would imagine, for your entire organization in the impact you were able to have in helping across the globe, but really here also, the impact in helping our society as a whole and the country in the time of the pandemic. That's a fairly new concept for most of us. But I know that during that time, there was probably a great deal of pressure on employees. You were taking care of their safety in the locations, but all of us have been grappling with how do we care for our teams and our employees, their mental health and their physical health, and through this time. Were there other things that the organization did in order to help your employees get through this time?
I mean, there were all kinds of things. We made our employees understand that we were committed to them. We didn't, even production facilities were volume 1.5. We didn't lay anybody off. We had certain jobs that, I don't know, we would normally have tons of customers that come to headquarters, and, those people we found other positions for, and things like that, where they knew we had our back. I'm not that aware of the details, but I know the need for psychological counseling and things like that went up a lot. And Medline, covers that, and we have programs on that. And I'm sure not just with Medline employees, but people everywhere, the needs for that probably were much higher. We also were helpful in the communities. We, in Chicago and other cities, we gave out reusable face masks and hand sanitizer and in millions of these things, and tried to do what we could, especially in communities who were more in need, to provide what we could. We also, my cousin and I were very philanthropic with, the Illinois COVID Fund and other areas, and Medline donated to a lot of different things as well. And we tried to do our part, and, it felt, or I felt at least, very patriotic about this, especially in the early part of the pandemic, where, this was sort of like a war, and you're trying to do what you could to help. And I was lucky enough to go to the White House, and it was a very interesting time, and we were just trying to do what we could to be a good corporate citizen.
Well, an incredible impact that you and your employees have all had, I think, through this time. And I have to imagine there's a sense of pride and fulfillment in being able to play that role during this time. There are other emergency efforts that you've been involved in the past. You were also involved in medical supplies in New Orleans after Katrina in 2005, and then I believe, and then also Houston after Harvey. Can you talk a little bit about those situations and how you as an organization are able to step up in those kind of times?
Well, first, for any of the situations, whether it's a hurricane or tornado, or we have a whole disaster response system, and we have backup satellite systems for our distribution centers, and we have backup generators for power and things like that to be able to operate, because many of the products we sell are literally life-saving, and so we've worked hard at that. Katrina, actually, what happened, we brought a helicopter, rented or chartered a helicopter with the thought we were going to deliver supplies, and we delivered some supplies, but mostly what we did was rescue people. We were going to hospitals that had people stranded and with the flooding, and we were bringing them out of New Orleans to areas near there that were safe. And that's primarily what was actually happening. And in Houston, we were delivering supplies. So, you know, we tried to be good citizen on these things. To Puerto Rico a couple of years ago, hurricane, and we spent a lot of money and effort to continue supplying hospitals down there where things were hit pretty bad. So we've focused on it. I don't know. There was a tornado in Nashville about a year and a half ago, right before the COVID hit, I think, or maybe right in the beginning of it, and it hit our warehouse. And we were actually sharing. We had an arrangement where we had space for Vanderbilt Medical Center in our distribution center, and we, within one day, were delivering all their supplies and our other customer supplies from our warehouse in Louisville, Kentucky, and had staffed up and, you know, made a lot of changes, and then got down to manufacturing and fixing all the things in Nashville that we had to do to get that warehouse operating, and maybe 5-6 months later it was fine. But we pride ourselves on having a good disaster recovery backup system, and I think it's been proven in a few good cases. So.
Well, you're there in the time where others need you to be their backup, right? So you're expected to keep running full speed ahead and be able to do that. Couple questions have come in, and before I move on, I want to talk a little bit about the future and some of your thoughts about the healthcare industry and post-COVID. But I want to go back and look at these two questions we've gotten first, because they're really talking about your sales background. So the first question we got was, as a former salesperson for Medline, do you have any tips that you learned that created unexpected growth?
So when I was selling, there were a couple things I thought were very helpful. First, building good relationships with customers, and today relationships are very important, but 30 years ago they were everything, and that was key. The second thing I did a lot of, I thought was helpful, and I would communicate this a lot back then. It's not so applicable now. Back then, it was prior to cell phones, and you, if I was at a customer's office and they had a problem, I would try to jump on that problem right away and literally use their phone and try to fix whatever the problem was. It might not even be a Medline problem, it might be a problem with another vendor. And I think they were fine with that as long as I was trying to help them. And the advantage of that is it really helped us, or helped me, get an answer to whatever customer very quickly. And in many cases, you know, I might be calling Medline's home office and the answer wasn't exactly what the customer wanted, but I could, because I was in the customer's office, I could ask him or her, you know, what about blank, 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 and that would solve it. So it's having the high sense of urgency was always helpful, and I've always wanted that. I have been a broken record saying, you know, wanted everything computerized or everything fast. You know, if we're going to ship the product to the customer, we might as well ship it today. It costs the same today as it will tomorrow. If we're going to get them an answer or get her an answer, we got to get it today. Let's not wait till tomorrow. That kind of thing. I don't know.
So speed.
I wasn't the best salesperson, and they, you know, frankly, there aren't many customers that they put me in front of. So maybe the other tip would be get people that can sell.
Well, we have a second question about sales. So listening is a key ingredient for success. I imagine your team had to respond differently during the pandemic. Did you change your approach with your customers to hear their needs?
Sure. So one of the things that came out of the pandemic, and the trend was happening through the years, is the transparency, the communication, the computer hookups on where products are in any location, what time they're going to get there, what day they're going to get there, you know, kind of like what people are used to from Amazon or FedEx, you know, roughly when, you know, what day the product will be there and all that stuff, if it's back ordered or anything like that. A lot of that communication really stepped up during COVID, and that will probably continue. And we have a lot of key customers where we're talking every single day, and they have a very good, very solid read on just about everything they're getting from us. And the vast majority of what they get, they order it, and then within, you know, 12 hours or whatever, they're getting it all. But there's items related to COVID where, you know, demand just skyrocketed that are on allocation, and they'll only get X amount. And but the communication's been very solid.
So it sounds like you increased communication
Yeah.
during COVID. I think also being aware of where all of your customers and your clients are at, right? Meeting them where they're at during this time, it sounds like also was an important part of your approach.
Sure, definitely.
As it disrupted, you know, a lot of businesses out there and even a lot of your customers and clients. Shifting to the future a little bit, given what you've learned and what you know about the pandemic spread, the vaccine rollout, and some of the behavior pattern changes, what future changes do you foresee for healthcare overall?
Well, there are other trends that were happening that will continue to happen and got sped up due to COVID. So telemedicine, for example, was, you know, slowly taking force, and the idea of not going to the doctor, but having the doctor treat you via telemedicine, whether it's, you know, FaceTime or you know, something Zoom, that has sped up and will continue. There are other trends, going to an urgent care center instead of the ER, that is sped up. More surgery is now happening outside of the hospital. Hospitals focused heavily on COVID patients, and some of that surgery is pushed out to surgery centers. So these trends and medical changes have happened and will probably not, you know, go back to where they were if, you know, COVID disappears.
Right. So if you think about Medline over the next few years, kind of in terms of growth and capital investment, and align that to some of the changes you've seen and understand, and a portion of those are going to stick. Some things will slide a little bit back to the way they were before, and other changes we've seen will stick going forward. What are the key focus areas for you around growth and capital investment?
So right now we have 8 million square feet of warehouse space under construction. We have maybe 1 million square feet of manufacturing space under construction. So in the US, we're going from 20 million to 28 million in warehouse space. And some of that warehouse space we won't need. We have a lot of customers who we're in partnerships with, negotiations with, to take space, and, you know, maybe we'll manage some of their inventory, but it'll be their location, or their part of the warehouse is only for them, or you know, we'll make shipments for their product, but they'll run their own area. They're all different ways people are doing that. And then there are other product lines that we've invested in that will, you know, hopefully be more prevalent for us. We've made some big commitments in the lab product areas, and that's grown tremendously due to COVID, and hopefully will continue with high level post-COVID.
So we've got some good questions coming in. So I'm going to revert to a couple of these, taking it away from kind of our focus on sales. This is a really interesting question, and I think a lot of us in roles have really had to think about this and stretch ourselves over the last year. But what has the pandemic and your team's response taught you about leadership? And what lessons do you have while leading the company through a crisis like this?
I've been very fortunate. I'm the CEO, but I have 2 cousins that work here, and frankly, we run the business together. And and we have a great team of executives that have been here a long time, and they've been wonderful. Maybe quite often our success is in spite of me. But we show up and we're working and we're trying to be as dedicated to the business as we can. And we always try to put the company first. And, you know, we kept most of our income back in the business. And, you know, I'm at the office right now, and I don't know, our offices, not many people here. We have a building of maybe 2,500 capacity for 2,500 people, and there might be 100 people in the building. But, you know, keep working and try to do what we can to be good leaders. And then part of it is, frankly, letting the people who work for us know that we have their back and that they can run things, and if they make a mistake, so be it. It's, you know, people are judged on their overall job, not one thing that happens, good or bad. So
yeah. So speaking of the cousins, there's a question that just came in that is, how do you keep the peace in the family when you run a family business, especially one this large?
well, that's a good question, but in a way, it's like being married to a lot of different people, and you try to make it work. And you know, we have certain rules for the family, and we're trying to run the business for the business sake. And the business, there are other executives that are taking more and more authority, so it's becoming a little bit less family run. The people that have entered the business in the family have started out in sales, and that was to make them very customer focused. And you know, it's a balance, and try to do the best you can. And certain family members might want different things than others, but overall, I think it's a plus. And I mean, if we were a public company, you have the same kind of, you know, some shareholders want bigger dividends, some shareholders want you to sell, some shareholders want something else. I don't know. So.
Couple other things coming in. So you've discussed taking risks and making long-term investments, which has obviously developed into successful growth. How does company culture play into this type of change and evolution?
Well, we have been very entrepreneurial, and we have maybe 15 or 20, or now it's 25 product divisions, and we, you know, they're charged with getting their results. I think we are trying to win and work hard, and at the same time care very much about our employees. I don't know. You'd probably have to ask the people under me better. I did a 360 survey about 6-7 years ago, volunteered to do it, and everybody under me gave me a 0 for empathy. So maybe I'm not the best one to answer those, but I think I think we're a good place to work for, and we do a lot of surveys and pride ourselves on trying to be a good place, and we've ranked high on many surveys. We were just entered on Forbes for national best places to work, and you know, so we work hard at being a good employer, and I think that helps with the culture.
Yeah. How did Medline think through scaling their distribution to ensure that all communities and health organizations in the Chicago area would be able to receive the Medline products they needed to meet the crisis for all Chicagoans?
So this is only really applicable on products that are in short supply, and there were different allocations, and we did a good job of trying to help markets that maybe historically wouldn't have had any inventory and then might not have gotten as much allocation, like nursing homes and things like that. We worked with other manufacturers. We worked with FEMA. Early in the pandemic, FEMA was very involved in directing where they wanted certain products to go. And we worked with them because everybody was asking for more. We did not, there's no allocation based on price or anything like that. There's, you know, we tried to do, we did supply historic customers. So if one hospital was not buying a certain category from us and another one was, we continued supplying the one that, you know, always purchased, and hopefully the one that didn't purchase would continue purchasing from whoever they were purchasing from before. But we did a good job, I think, of supplying everything. And by the way, like on PPE, our volumes maybe tripled or quadrupled. So it's we did get a lot more product out and continue to do that. And on many product categories now, it's been settling, meaning the shortages are going away.
One of the questions that came through a bit earlier that I want to circle back to, which I think is interesting for all of us as leaders to think about in our businesses, which is, what are some of the silver linings from the past year that you've experienced?
The silver linings. I think the FDA operated very quickly. You know, the approval on vaccines and other medical products, including, you know, things that we make, very fast, very impressive. I think the communication is been greatly improved. There's a lot of excess manufacturing capacity that, or not excess, but manufacturing capacity that got implemented very quickly. So these were all good things. And I really think, you know, this crisis, at least financially, health-wise, we're pretty close to, we're definitely, I think, unless the variants take off, seeing the beginning of the end. And, you know, hopefully we'll all have a great second half of 22 or 21 and a great 22. So.
Yeah, and you brought up the speed of the vaccine production, and I think we learned a lot of things during this time. And during a crisis, you know, we'd never want to welcome a crisis in order to learn some of these things, but I think there are some interesting things that came out of it. One is you mentioned the speed of getting to vaccination, which we've not seen before. I've not seen before in my lifetime, that kind of speed. And I think that was phenomenal, and we learned how quickly we can do that under crisis. And to your comments about manufacturing, I think we learned a lot too of how we can work and how we can work when we need to virtually, and how we can connect virtually. Not that we would want to do that 100% going forward, but it changed some of those dynamics for us. So there was quite a few kind of silver linings. Leads me into a little bit with employees working from home. There's been a lot of change. How did you help them adjust to working from home and keep them energized and engaged?
You know, I'm sure there's other companies that could probably answer this better than me, but I'm somewhat surprised at how well the work from home of office employees has done. And you know, most of our communication now we try to do visually. So whether it's Zoom or Teams or whatever, that's, I think, been helpful. And we've tried to have lots of things that would mimic what we had in the past. You know, last week and the week before, we had national sales meetings and awards and presentations, and it's just all visual. All, you know, but I don't know. We, you know, try to, we in certain jobs that were measured more on financial results, we've changed a little bit to certain projects and giving people, you know, a list of things to get accomplished to earn their bonus rather than just whatever the financial growth would be. Has been healthy, and some areas are going down and some are up, and so it's hard to just forecast in any accurate way how you would normally compensate people. And so saying we want certain things done is, I think, help keep people more engaged. Uh-oh, I'm not hearing you. And
Can you hear me?
now I hear you. Wow.
Okay, excellent. Yeah, the recognition, reward, and kind of energizing our teams to keep going under different conditions, I think has been a really important part of what our organizations can do through this time. I think that, you know, when you looking at the future and looking at kind of the work model for you all in the future, as we start to go back to working in person, do you foresee that your model of in-person versus virtual will be different than it was in the past?
It will be a little different. It won't be a lot different. We're discussing what we think. There's certain jobs that we feel can work well on a permanent basis from home, and there are other jobs where the collaboration with everybody is more helpful in an office. So we're sorting out that. And then there's a lot of jobs though that are office, but maybe a day or two a week might be from home, and kind of a compromise between the two. And you know, there's certain meetings I think that are a little more effective. And I mean, when you get down to it, we're selling products and things, and it's helpful to, you know, be able to look and touch and feel things. So there's certain jobs that maybe, you know, 3-4 days a week they'll be in the office, and once or twice a week not. And then there are other positions where, hey, maybe it just makes better sense to be permanently from home. It depends a little bit on what the person's doing.
Yeah, and probably also as we start to go back to that, some experimenting on what works across different parts of the business, right?
Yeah.
I think there's a lot of unanswered questions for a lot of us right now on what that going back looks like.
And many things, it's hard to know the cause and effect, and certainly things are running well for Medline. But you know, much of our success in any given year is usually from things we did a year or 2 or 3 before. And you know, whether it's a new product launch or a new building we built, it's the benefits don't seem to pop up right away. And so a little bit hard, but I think things have been functioning quite well during the past 12 months.
Well, I think that, you know, looking from the outside, it's such an amazing story, and the opportunity to learn your family story. I was honored to be able to talk to you before we presented today and talked about things, but I think for the audience to also hear the family story and the generations is just incredible. And then what you've done as an organization over the years and your growth is, you know, second to none. And then I think that, you know, knowing how you stepped up as an organization during this time, your organization should just be so proud and fulfilled with what they've been able to accomplish during this time, and what they've personally some sacrificed and long days and, you know, during this time. So I want to personally thank you for what the organization has given back to us across not only the US but globally in how you've helped get through the crisis, but also just for the organization that you are and the success you've had. Being a Chicago person, I'm very proud of having organizations like yourself, you know, to speak to that are here in Chicago with us. So do you have any final things you'd like the audience to know about Medline before we drop?
One, I want to thank you for doing this, and you know, again, reiterate, I want to thank our employees for all the hard work they've done. And my grandfather had a little tiny business in Chicago, and we moved to Evanston, and now we're in Northfield for headquarters. But you know, this has been our home for 4 generations, and hopefully, you know, a long time in the future. Very much appreciate it. We want to thank all the frontline workers for really tremendous job and risking their life and helping others. I mean, really tremendous. So, and I'm hoping, you know, COVID goes away and we all have a much better future. So.
I think you've got all of us with you on that last one there.
Yeah.
Charlie, thank you so much for making the time to join us today and for talking about some of these things with the audience.
Okay.
It was really nice to have you.
Thank you, Linda. All right.
Thanks.
Have a great. Bye.
You too.